Good morning, everyone. Good morning. This is Bill Miles, and welcome to the Chamber's weekly Teletown Hall. We're delighted to have you back with us again this morning. As communities across the country consider whether to reopen schools and offices this fall, many of us are pinning our hopes to a COVID-19 vaccine that we hope will soon be available. And I'm pleased to report this morning that there are currently 598 clinical trials for COVID-19 vaccines and therapeutics are happening across the United States. And while those trials are taking place in all 50 states, 15 of those are actually taking place right here in South Carolina. So I think that's certainly good news. And as a reminder, there are currently 25 vaccines in the clinical stage of development. And even more positive news there is just 2 days ago, 2 entered into the final stages. Well, we're heading into our final months of summer this week. August also marks the beginning of the busiest months of storm season. And your chamber is encouraging you to once again be prepared. In partnership with our friends at Hargray and SCORE, we're offering a virtual seminar this Thursday featuring Chief Meteorologist Chris Allred with WSAV and other experts to talk about how we can all stay safe and prepare our families and our businesses for hurricane season. We put the registration log in the chat box below. And if you'd like to be part of that Zoom call Thursday at noon, please register. August also marks the traditional start of the school year. But as we all know, this year has been anything but traditional. Last week, we were fortunate to hear from Dr. Frank Rodriguez, our Beaufort County School Superintendent. And this week, we're going to take a look at the state perspective with our first speaker. Our education leaders are grappling with an unprecedented decisions. As COVID-19 has taught us all, there are no perfect plans. And that holds true for business, tourism, healthcare, education, and so much more. And we've all learned to be flexible, adapt, and thrive in a challenging time. She oversees 79 school districts across South Carolina and is responsible for overseeing the education of thousands of students. It's a monumental task without the challenge of COVID-19, but ensuring our students and teachers are safe during a pandemic brings a special set of challenges. And with us to talk about planning for back to school following the governor's recent mandate on school start dates is our own state superintendent, Molly Spearman. Superintendent Spearman, thank you so much for being with us this morning.
Thank you, Bill, and good morning, everyone. Bill, I appreciate your optimism and your news about the vaccine trials. Gives us all hope, and we certainly need that in these days. I'll share with you just a few things that's going on here in the state of South Carolina. You mentioned on reference Governor McMaster's request about 2 weeks ago that all schools in the state open with face-to-face learning 5 days a week for all students. It was obvious that I did not agree with that request because while we do have some schools that might be able to open, this is a very fluid event. And it is happening at different rates in different communities, and we must leave these final decisions to our local leaders working together with their health experts. You have a tremendous leader in Dr. Frank Rodriguez and his team down in Beaufort County. They're doing an extraordinary job. I just spoke with him this morning on the phone. We have some other discussions planned as to how things are going in Hilton Head. But I'll share, and across Beaufort County, I'll share with you where we are. I'm currently reviewing plans from all 79 districts. We just released the first 5 plans, and in that group of plans, you'll see that there's a mixture. There's a mixture of elementary students coming back 5 days a week to hybrid, where students will be on virtual, middle school, high schools, attending 1 to 2 days a week in some type of hybrid setting and then going home to do their work, to a 5-day-a-week district that feels like they will be able to do that safely. So this is an extraordinary task. I'm not taking it lightly. And our number one review criteria is the safety of the students and staff. We're also looking at the high quality. How are they going to deliver instruction? I think it's important for all of us to remember that the instruction that we gave back in March was emergency instruction. It happened overnight. We did the best we good. We had 19 districts of our 79 districts at the time who were able to deliver pretty good instruction through e-learning. We have progressed now and have 45 districts that are categorized as e-learning districts. That means they've gone through a strong review. They have their teachers trained to deliver virtual instruction. They have the devices ready for all students, and they can do this in a pretty sophisticated way and have two-way communication with most of their students. So we're progressing. We have another 27 districts that are working in the readiness cohort, and that means that they are mentored by those districts. So I feel pretty good about the status of those districts as well, and a few others that are about to go into that category. But we still have about 10 districts who cannot deliver virtual instruction at a high level. I'm very concerned about those districts. We are working with our telephone providers, with our virtual hotspot providers. You know, the legislature just appropriated $20 million to buy additional hotspots, and also to pay if a family cannot afford to be hooked up or to that access for the internet. So we will be in much better shape when we go back to school in just a few weeks with our virtual learning. The expectation will be much higher. In March, we did not take attendance. We counted everyone as attending. That will not happen when we go back to school. Attendance will be taken every day. Students will be engaged each day. If not, they will be counted present. So we'll be able to keep track of our students much better than we were in March. And finally, as we move to that instruction, it's really important that we take care of our students who have special needs. And most of our districts, in fact, we're looking at that. That's one of the strong criteria that we're looking at as we approve these plans. How are you going to deliver the services to our special needs students? Most of that has to be done face-to-face. So we're looking at that and working with our districts to make sure this special group of our population gets the services that they need. We will be announcing today another large group of districts plans that have been approved, and we hope to have all of that completed in the next few days. We'll be working with those districts. The biggest challenge is the high spread across South Carolina. And our guidelines say that at very high spread, and right now every county in South Carolina is at high spread, that we would go virtual. The issue, though, is that that is just one indicator, the spread of the infectious disease. We know how badly students need to be in school because we assist them not just with content learning, but with their social and emotional needs. And balancing that decision of can we afford to allow all of our students to be at home working virtually with the need for them to be in school with a teacher? We know that our child abuse cases reporting is down over 50% in South Carolina. That's because our teachers and our school administrators are the eyes and ears and love for those students. And we need to have personal contact. So I am really encouraging our district superintendents to include in their plan, whether they're virtual or not, some type of personal, putting their eyes on the students as they come back to school. So that's a general overview. I'd be happy to answer any questions if you have that. But I think I've used all my time. Thank you for keeping us in your prayers. It's a tough decision, and quite honestly, we're doing the best we can because nobody has the exact right answer.
Thank you, Superintendent Spearman. We do have a couple questions for you, but I certainly have a comment before that, and that is, yes, Dr. Frank Rodriguez, we are very fortunate as a school district to have Dr. Rick Rodriguez leading our education efforts here in Beaufort County. So he's a great one for us to have. Our first question
He's a prince.
Yes, he is. Our first question comes to us from Molly this morning, and Molly is asking, will the virtual students be given access to lunches?
It is not required, but we are encouraging our district's superintendents to continue delivering meals, and they can do that under the USDA approval. The difference in the meal service now over the last few months, since March 16th, we have served over 22 million meals in South Carolina. Not only prepared them, but delivered those to the students, and they were at no charge for any student who came to the bus to pick those up. When school starts, we'll be under a different procedure in that those students who need to pay will have to pay. That waiver has not been granted. So it makes it a little more difficult for districts to deliver meals, but I hope that they will continue to do that while if we're in the virtual situation.
Thank you. We have another question from Deborah, and Deborah is asking, how will testing be handled?
Well, we have 5 days that we're calling the LEAP days that have been funded through the CARES Act money, through the governor's office and the legislature appropriating. Those 5 days are additional days at the beginning of the year for pre-kindergarten through 8th graders. I've asked superintendents, they must invite all students to come in at least one day. Students don't have to attend. It will not count against their 180-day enrollment, but they must offer that. And during that time, assessments could be given, not just in content, but also social and emotional assessments. And then during the first 15 days of the regular school year, additional assessments can be given. Some of those can be done virtually, not all. We're working with those companies and with the school districts now. Those are the beginning of the year assessments, and the state legislature has asked us to do a pre-assessment as students come back, and then a post-assessment sometime around the end of the first semester in December to make sure that our students are progressing. I did ask for a waiver from our federally required assessments. We've sent a letter to Secretary DeVos. I've not heard back on that. That would be the spring federal assessments that I think we probably should not give this year. I'm not real optimistic. I know that 2 other states have been denied their request, but I think as we move forward, and if COVID-19 continues to disrupt our normal procedures in delivering instruction, that we will be able to get a waiver from those federal assessments, but we'll just have to see how the year goes.
All right, another question from Nicole. And Nicole's asking this morning, has there been any guidance in regards to after-school programs?
Not so much directly after school programs. I'm not sure if you're talking about, the regular Boys and Girls Club kinds of meetings. Those things can go on in working with the local district. They're making those decisions there. Extracurricular activities, athletic programs, where those decisions are being made by the South Carolina High School League. Generally, though, if school is not in session, those activities cannot happen. So we're waiting to see what will happen here and listen for the announcement from the South Carolina High School League.
All right, and our last question this morning comes to us from Chuck. And Chuck is asking, did the state take into account recommendations by the American Academy of Pediatrics regarding the harm being greater for children outside of the classroom?
Absolutely, Chuck. In fact, I met with the officers of our own South Carolina Pediatrics group. And that is one reason, if you saw recently, I have upgraded the capacity level on our school buses. I am requiring face masks on buses, and that has allowed us to increase our capacity, not to full capacity, but to about 66% capacity, which adds another 10 or 12 students on each bus. And as I speak to superintendents, I'm talking to them because they're in a terrible, terrible place, because we have this guidance that says, at a certain capacity, you should go virtual. But at the same time, yes, they have to weigh in the other things that we do for students in delivering their social, emotional support, their food service, whatever those relationships are. So we're taking this very seriously. The American Academy's work is very honest and revealing, and shows again just how important it is for schools to be in operation. So yes, that is weighing in on our decisions, and I am reminding superintendents of that every time I talk with them. But it is a balance, and of course our teacher force, many of them are very reluctant to come back to school because they too have health situations. They have their own families that they're worried about. So it's not just about the children, even though the number one priority is the children, but we have to consider the safety of the staff as well.
Superintendent Spearman, thank you so much. We know your days are
pleasure.
incredibly busy, but we're delighted to have you with us and appreciate the great job you're doing. Thanks for joining us.
Thank you. My pleasure. And good luck to all of you down in Beaufort County. Stay safe. And please, if you want to see us go back to school, put on a mask. That would help. Thank you.
We'll do it. Thank you. Have a great rest of your day.
Thank you.
Our next speaker this morning is here to share some great research and insight on what's on the minds of South Carolinians during the pandemic. Is Peter Lamont, and Peter is the Senior Vice President of Chernoff Newman. He's a 20-year veteran in crisis communications, marketing, and reputation management. He's been called upon for his expertise by the Wall Street Journal, Washington Post, and numerous other media outlets. Prior to his time with Chernoff Newman, Peter spent 10 years on the communication front lines of Washington before making the right decision to come back home to South Carolina. If the Lamont name sounds familiar, that's because it is. Peter grew up in the Low Country, and his father, Dr. Peter Lamont, and his friend and colleague, Bill Bethea, built the Hilton Head Island Hospital in 1975 after Island founder Charles Fraser lured him to South Carolina from New York. Peter, welcome to the call this morning, and we're looking forward to hearing your insights.
Thank you, Bill. It is a real pleasure, especially to be on with the Hilton Head Island Chamber. As you mentioned, I am native, born and raised on Hilton Head and back in the Low Country, so I really appreciate the opportunity. I only have a few minutes today, so I want to make sure I'm brief, but I want to give you a high-level background on why we conducted this poll. Back in April, we saw a need to look beyond the national polling to get a better sense of what consumers were thinking here in South Carolina specifically, because it was a completely unprecedented event at the time. So we really wanted to get some insight. Many of us back then in April felt that we were, of course, the world was going to be changed. It was a pandemic, but by now in the middle of the summer, that, well, COVID would be well under control. And sadly, as we all know, that isn't the case. In fact, what we do know now is that COVID isn't going anywhere anytime soon. So that leaves us here in July taking a new hard look at consumer sentiment across the state. And that's why we did this second version, and we'll do a third version of consumer sentiment. And we did this for North Carolina as well. But as far as businesses are concerned, we use this word consumers, but this is more than just our customers. This is our employees. These are our partners and people that we deal with on any given day of the week. So I want to be clear of this data. I will also say this is part of a much larger survey. And you'll see on these slides, there's a link, there's a mention of a website, but at insights.chernoffnewman.com, you will see the much larger study. I'm specifically focusing on travel and some consumer sentiment around retail, but if you want to see more, feel free to go there. So first want to take a look at how people are feeling, how it's affecting their perception of work, because this has a great impact well beyond just Hilton Head or Charleston, but the whole state, the whole Low Country as well. Take a look at this slide. So this is general perception of people as it relates to both the economy and to the coronavirus. As you see, it's not a very rosy picture. Very, very few people think that the worst is behind us in which either is concerned. And as that relates to the virus and the darker green color there, you'll see it's a lot worse. This is important for businesses and individuals just to be aware of as we formulate our strategies going forward. But this is probably one of the more interesting aspects of the study that I've found. If you look at this data point and how it relates to employees' willingness to go back into the office. And as you can see on this slide, there's been a 50% increase in employees who plan to continue or prefer to work from home. That's an important slide anecdotally, because I think we all know people who have decided, whether they've moved to Hilton Head, that they can do their jobs from wherever they came from remotely. But more importantly, for the businesses around the Low Country, this is going to have a tremendous impact on the types of operational effects, such as, how are we recruiting? How are we going to hire new employees? How is the IT infrastructure going to be handled? And that's not just how are we going to get laptops to people, but how do we worry about cybersecurity now that their home is their office? And then what are we going to do with all that leftover office space that they vacated back in March and April? And then finally, let's not forget the impact this is going to have on a company's culture. So two very interesting pieces that I wanted to touch on before we get into the aspects of travel. I want to take a brief moment to talk about what consumers, what they need to feel in order to be safe going into a business or working at a business, and two, what consumers are most willing to do now or in the near future to change their behavior. In this slide, you can see data showing that if they take the actions required to show their concern for health and safety for their customers and their employees, it will be rewarded. As you go down this list, whether it's mask, distancing, whether you're putting out the signage, and so on, the numbers are overwhelmingly suggesting that people will be more likely to frequent your business if you take these extra steps. And this is important because we have, on a statewide, we have the Palmetto Promise, Hilton Head Promise. In Charleston, we have the One Region Ready pledge. When businesses take that action, they are rewarded. And you can see across this slide in the small numbers beyond the gray to the right, those are the percentages of people that are either much more likely or somewhat likely, but both positively impacted by businesses simply putting the effort in to address the crisis. Now, in this slide, you can see the comfort level that consumers have with a lot of actions. Now, this data is force ranked according to already comfortable. That's that sort of Kelly green, darker green. So starting at the top, you can see that people are more likely than anything about going to the doctor, a non-urgent doctor visit. And those are people that are already comfortable. You can see the key at the top. And it goes down from there. So we just heard from Molly. It's important to point out in the top right with the comfort around children going to school. That includes schools, daycares, camps. It's more than just going back to school. But if you look at the very bottom, for example, it's what you would expect. Large group events such as concerts, there's something that people are generally uncomfortable with. And that's why you've seen across the state, most of them being canceled, or in some cases, in the more innovative areas, they're being completely reimagined. So as we move ahead to travel, we all know that tourism, hospitality, food and beverage, just travel in general, is a huge economic driver for Hilton Head and the Low Country, the entire coast, as well as the state. So we at Chernoff Newman, we work with a lot of whether state agencies or businesses that are related to travel. So we wanted to make sure that we dedicated a section of this larger study of what, again, there are more questions around this, dedicated to just the impact on travel and how people are feeling as it relates to travel and the comfort level currently and in the near future. So taking a look at this slide, we wanted to measure the confidence levels in individuals who typically took summer vacations and are thinking about taking a summer vacation. While the numbers may not look that great, I'd like to point out that the numbers in the category of very confident that they would take a summer vacation now had doubled since April. And in the category of not very confident had actually reduced considerably. So you see some big swings in some of this. But this doesn't necessarily spell gloom and doom based on what we see in the next slide. when we asked people where they were planning on going for their summer vacation, pay particular attention to that first bar. Because what it essentially says is that 1 in 5 people are staying in state simply due to the pandemic. And the implications on resorts, visitors bureaus, and others in this industry, how they will now advertise, how they're going to market and do outreach to a substantially different audience. Anecdotally, I can tell you that I was vacationing in Bluffton with my family recently, and I kept running into people who were from Columbia, who were from Greenville. Yes, there were still the folks from out of state, but there was a much larger percentage reflected in this data. Then you add in on this slide another 23% that were planning on staying in state. You see it as well in the Southeast. And this is what the stay local idea, this is the impact it's going to have if we look at our next and final slide. Here, we simply asked about the comfort level based upon travel activities and when they thought they would be comfortable returning to them. Now, keep in mind, the respondents in this section are all individuals who told us that they typically attended an outdoor activity or they traveled by car or traveled by plane prior to the pandemic. So if they said, I never travel anywhere by plane, they were not included. But clearly what you can see is people are much more comfortable traveling by car. And what I find interesting is looking at that plane data. It shows that almost 10% of people who used to regularly travel by plane to get somewhere are no longer planning on doing it again. Period. End of story. But overall, what you see is that people expect that from about a year from now, the majority of their activities will be back to where they were prior to pre-pandemic times. I'll also point out, even though this study is only a couple weeks old, we have already started formulating the questions based on these results that we'll be asking, most likely, I'm guessing around late September, and we're going to start questioning how's it impacting holiday travel? How is it beyond just travel? How is it impacting? Because by the end of September, we will already have kids in school for a while, depending on the county. So how is that impacting behavior of families? And how is it really impacting their plans on travel? Where are they planning on going? So this is an ongoing study. I, once again, very briefly wanted to just hit on some of the more relevant slides. Again, you can see in the bottom right, here, I think a little bit bigger here, view the study. My information, if you have any questions, feel free to reach out. But this is part of a larger study. What we are trying to do is gain insight for businesses and individuals and organizations as to how people are really changing their opinions. And I will tell you what's not on here. Most of these demographics, most of the opinions, most of the behaviors actually haven't changed since April. When people committed to one way or the other in April, they pretty much haven't changed since then in how they feel about just the coronavirus in general, their perceptions, their impact on the economy, and how it's changing their behavior. So I appreciate the time today, and if you have any questions, please let me know.
Peter, thank you. And yes, we do have some questions for you, but thank you for the terrific presentation. Early on in the game, in preparation for reopening, the Chamber spearheaded the Path Forward Readiness Plan with input from hundreds in the business community and residents in government. How important is it to have a plan like this in place, and what's the impact on consumers?
It's a great question, and you know, there's so much data in here that I couldn't show, but I will tell you one fascinating piece of information that came out of it around governments, whether they be federal, state, or even down to businesses, and how important it is to have these plans and make decisions accordingly. What we saw in this study was an overwhelming willingness of consumers to give the authority to businesses, local government, and even federal government around mandates and around direction. So what it essentially showed in the study was that if you make the decision, whether that be a business saying you have to wear a mask, or a, obviously very controversial in the media, but and on social media, lots of discussion and pushback and back and forth about, mask mandates and things like that. But overwhelmingly in this study, we found that people were willing to give that authority and listen to, or the business authority, as well as the governmental, local, and federal authority.
All right, thank you. Next question comes from Mark, and Mark is asking, how has the level of concern among consumers changed as the number of cases continue to rise?
Yeah, and a good question, Mark, and I alluded to it a little bit. What's fascinating is think about where we were in April. We were just stepping into this new world, and we didn't know where we were headed. And now we are getting a little more complacent in the news, at least. We see these numbers rising all the time. So the numbers are rising. Different third parties are weighing in. All kinds of outside influences are hitting consumers on how they theoretically think about what's going on. Yet the opinions have barely changed. The opinions have held true as it relates to, are things getting better, are things getting worse? What were you planning on doing in April as it relates to, I'm going to wear a mask or I'm going to socially distance? For the most part, if I have to generalize it, and it's not a far stretch to generalize it, those people that made up their mind in April stuck with it in every aspect, whether they were for mandates, against I shouldn't say mandates, whether they were for wearing a mask at all times, social distancing, whether they thought things were going to get worse, whether they thought things were going to get better. If they formulated an opinion in April, they pretty much have the same opinion today. Really interesting.
Thank you. Another question comes to you from Reed. With your background from Washington, what are your thoughts on how COVID-19, coupled with the social issues we're facing, will impact the upcoming elections?
Well, I'm going to deflect on that one. And here's what I will say. One other thing and Reed, great question, and maybe we can talk about that offline. But but what I will say is there was another part of this study that we did, because when it went into the field, we were just on the other side of a lot of the marches and some of the looting we had here in Charleston and across the state. So we wanted to measure what consumers felt about businesses as they took a stand on political issues, because that's always, as we all know, that's a delicate balance for a business to wade into these issues. And what was really interesting is it was an even split of essentially, I like it when a company weighs in and I don't like it. Then the only thing balancing that were people that didn't really have a concern about it. So what I would say is that, you try and bring this all together, what people thought about COVID, bring it all together with what people are thinking about some of the political discourse that's going on. And people's opinions are not as easily swayed as you would think, based upon external influences.
Okay, and our final question for you this morning, Peter, comes from Tom, and Tom is asking: do the results of your studies are they similar to what you found in other parts of the state or country?
Yeah, it's a good question. So we did this study specifically in North Carolina and South Carolina, and an equal sample size. And with very little exception, we mirrored North Carolina. And we have all of that data to look at, how does the low country look at things versus the upstate. It's not in this. To be totally candid, I've been so focused on telling the South Carolina story, I haven't looked at it by region. But I can tell you, state to state, we're in alignment, and with a few maybe different opinions on the handling by political leadership, a few different things on just exposure. We are very particular around college football here in South Carolina. I would say slightly more so than North Carolina. So opinions have varied on when people want to get back to seeing football games or sporting events, as we call them. But we know what sporting events, for the most part, they're talking about. Those are changed, but for the most part, they mimic each other. And we've seen that to be true when we look at national polling done by larger national firms, that they too have sort of mimicked the numbers that we're seeing here in South Carolina.
Peter, terrific information as always. Thank you for being with us this morning and sharing it. We look forward to seeing you back in Bluffton and on Hilton Head Island again soon. Thank you again.
Absolutely. Thank you.
All right. That was Peter Lamont, and we were delighted to have him this morning with us. Our next speaker is Jeremy Clark. And as we all know, Jeremy is the market CEO for Hilton Head Regional Healthcare. And Jeremy, we're looking forward to another update from you again this morning.
Thanks, Bill. It's great to be back, and it's great to follow Peter. It's great to hear from him, and it's timely given that in the next 2 weeks, Hilton Head Hospital will recognize our 45th anniversary of serving this community. So it's great to hear from Peter today. I appreciate being back. As in previous weeks, Hilton Head Regional Healthcare continues to operate safely and effectively. We'll start off by giving everyone an overview of what we're seeing here locally. As of this morning, Hilton Head Hospital and Coastal Carolina Hospital have a total of 16 COVID patients in our hospitals. Of those 16, 3 are in our ICUs. This is actually a decrease from what we saw last week and 2 weeks ago as well. And we're starting to see some flattening in the number of hospitalizations, at least right now. So we still have capacity in our medical beds, but also in our critical care beds as well. As far as what we're seeing, we are seeing patients continuing to test positive in the community. The vast majority of these are local residents. These are not individuals from out of town. And thus far, most have had symptoms that do not require hospitalization. So while we are seeing more cases in the community, we're actually starting to see the positivity rate, or the percentage of patients that test positive, starting to flatten as well after it had been rising from June into mid-July. Additionally, we are starting to see the average age of positive patients starting to stabilize as well, again, after it had been rising or getting older over the previous 6 weeks. So we want to remind everyone that this remains a very serious disease. Would ask that everyone continue to wash your hands, wear a mask, practice social distancing. It remains very serious in our community, locally and across the state. Also want everyone to know that if we do see a surge of COVID patients, we remain ready for that. We have our well-developed plans where we can repurpose staff and beds and vents as they are needed. We remain well stocked in our personal protective equipment. My team and I are meeting regularly to review both our plans, but also the situation locally, to make sure that we can quickly implement plans if our local situation changes. I mentioned testing a little bit earlier. We continue to do a lot of testing. We are currently doing about 1,000 tests a week, the majority of which are in our outpatient testing drive-through centers, which are located outside the hospitals every weekday morning. There is no cost to patients for these tests. There's no appointment required. However, we do require a physician order to get them. But additionally, we are working with local partners to offer a kind of repeating testing events throughout the community. And these events are free, no physician order is required, and no appointment is necessary for these events either. We have a few coming up. Friday of this month, July 31st, we'll be at the Second Utah Baptist Church in Ridgeland. On August 5th, we'll be back on Hilton Head Island at the high school. On August 11th, we'll be at Defusky with their fire rescue team. And then on August 19th, we'll be back at Bluffton High School as well. All of these events will take place from 7 a.m. to 11 a.m. in the morning, with the exception of Defusky, which will be in the afternoon. Again, no cost to patients, do not require a physician order or an appointment. And I'll always say it, but we're very fortunate to have great partners in the community to help us offer this service. You know, testing is just one part of the safe environment that we've created. We continue to screen all patients and visitors, employees who come in. We're really mandating that patients and visitors wear a mask when their caregivers are present, just to maintain that safe environment and keep our employees safe. We continue to space patients out more, adding walls in certain areas just to keep patients safe. continue to cleaning more, offering more hand sanitizer throughout our organization. So I continue to feel very confident in the steps we are taking to create that safe environment. So while we are still treating COVID patients, I want everybody to know the vast majority of patients that we're taking care of are not seeking care related to COVID-19. Patients are still choosing us for emergency care, still choosing us for elective surgeries, which we continue to perform. And we're able to provide this high quality, safe care because of that safe environment that we've created. So just to wrap up, I just want everyone to know that we remain ready. We've created the safe environment today, and if we do see a surge of COVID patients, we're ready for that as well. We have our plans ready and can implement them as needed. We are seeing some flattening in COVID hospitalizations, but we remain ready. So, Bill, as always, I appreciate your leadership. I appreciate the leadership of our state and local officials, and really just appreciate the support of our community for our caregivers and everything that everyone is doing today. So I want to remind everyone to wear a mask, wash your hands, keep your distance. And Bill, I'll turn it back over to you if there are any questions.
Thanks, Jeremy. A couple questions. The first question comes from Ellen, and she's asking what the general turnaround time is for test results.
Right now, we're seeing about a 3 to 4 day turnaround time for outpatient test results. I give a lot of credit to DHEC, who continues to work to add capacity and improve on that turnaround time, despite the fact that there are an incredibly high number of tests being run across the state that they are responsible for. So very thankful to DHEC and their work to continually work to improve turnaround time.
Thank you. Next question comes from Brennan. And Brennan is asking, do you and your team attribute the masking ordinance to some of the reduction we're seeing in COVID cases?
Yeah, absolutely. We really, as I've mentioned, we started to see some of the indicators flatten off, which is good. And I think a lot of that is due to the masking primarily, but also just other social distancing measures being in place, and everyone really being more cognizant of it and hopefully aware of what a serious disease this is.
All right, thank you for that. The next question comes from Mary, and Mary's asking, are you still seeing residents hesitant to come to the ER when necessary due to the fear of COVID-19?
We have seen our ER volumes continue to pick up and get back to closer to normal since the mid-March and mid-April lows. So it's great to see patients not being afraid to put off the care that they need. Again, we've created a very safe environment inside our emergency departments across the market, both at Hilton Head Hospital, Coastal Carolina Hospital, and our Tidewatch Emergency Department, which is actually not attached to a hospital. We've created very safe environments in there and are able to take care of patients. It's good to see patients coming back to receive that emergent care when they need it.
Jeremy, thanks for your encouraging news today and hearing the 16 COVID cases and how that's down from the previous 2 weeks. Certainly good news and creates some optimism for all of us. We know we need to continue to mask up and be safe, but also want to say congratulations early in a couple weeks to that 45 years. And you think about Hilton Head Hospital and what it has meant to this community and to this region is incredible. And I know throughout all those 45 years, there's been great need, but there may have never been a greater need in time for Hilton Head Hospital to be existing in our community. And we just thank you for your leadership and your support and helping keep our community safe, Jeremy, you and all your associates and colleagues there at Hilton Head Hospital.
Great. Thank you very much, Bill, for the kind words and for all your support and the support of our community. We appreciate it.
All right. Thanks for being with us again this morning, Jeremy.
Thanks, Bill.
Talk to you soon. Following Jeremy Clark, we have Dr. Michael Katka again, and we're happy to welcome back Dr. Katka with DHEC this morning. Dr. Katka, welcome.
Thank you very much. It's good to be with you again. So as usual, I'll provide an update on our current numbers. So as of yesterday, in the past week for the state of South Carolina, we're reporting 10,619 confirmed and 153 probable new cases of COVID-19. That's for the week total. That brings the total number of people in the state with the disease to 83,720 confirmed cases and 389 probable cases. For Beaufort County, for the past week, this includes 600 new confirmed cases and 4 probable cases in the past week. Total for the county is 3,180 confirmed and 8 probable cases. For the Hilton Head zip codes 29926 and 29928, there have been 133 new cases for the week, bringing the total there to 618. And for the Bluffton zip codes of 29909 and 29910, 231 new cases were reported for the week, bringing the total to 1,043 cases. So although the state of South Carolina has seen a decrease in the number of cases from the previous week, Hilton Head, Bluffton, and Beaufort County have seen an increase in the weekly case counts. The 600 new cases reported for Beaufort County is higher than the 487 from the week prior. The 183 new cases for Hilton Head in the past week is higher than the 59 from the week prior. And the 231 new cases from Bluffton is higher than the 124 reported in the previous week. Unfortunately, today we're also reporting 302 additional confirmed COVID-19 related deaths and 42 probable deaths in the state for the past week. This brings the total number of people confirmed who have passed away from the virus to 1,505. There have also been 60 probable deaths reported related to COVID-19. There have been six additional confirmed deaths reported in Beaufort County individuals, and the total there is at 34. One additional probable death has been reported in Beaufort County, bringing the total there to 2. New deaths reported in the state increased last week compared to the previous week from 217 confirmed deaths in the previous week, the week prior, to 302 confirmed deaths. So from 217 to 302 in the 2 weeks. Confirmed deaths occurring in Beaufort County individuals remain steady at 6 new deaths reported in the week compared to 6 deaths in the week prior. So moving into the theme of school reopening, I wanted to cover a little bit of DHEC's role in the school reopening. So DHEC's been working closely with the Department of Education to plan the school reopening guidelines. We understand it's important to balance the need to control the spread of the virus and the harms that come from keeping children out of school. DHEC will continue to provide county-level indicators on COVID-19 to aid in decisions about operating schools. CDC recently released new guidelines. They're pretty similar to what DHEC has provided in the past, but we will continue to review them and monitor for any more guidance. This will be an ongoing process as we learn more about how best to manage school operations and protect student and staff. This is a very tough situation for everyone, and we will continue to work with our state partners to move forward as safely as we can. And I will echo Superintendent Spearman and request that you please wear your mask to help us get children back to school, and don't forget to practice social distancing and good hand washing. So more information about our school guides, information on our data is available on our website, scdhec.gov/COVID-19. And I'm happy to take any questions at this time.
All right, Dr. Kaka, thank you. A couple questions this morning. And one is coming to us from John, and John is asking, how does COVID in children differ from adults?
So generally, children tend to be a little less susceptible to severe illness. Older individuals can have more severe disease. Obviously, children can have some health conditions that can make them vulnerable to more severe infections. There's been some data that it may not spread as easily, so children may be less likely to catch it and spread it to others. The data's not real clear on that just yet, so I want to be cautious about saying that, but that's something that's been suggested by some of the early data that we've seen. There is a severe condition that seems to be associated with COVID-19 infection. It's called multi-system inflammatory syndrome in children. Now it's very rare. It doesn't happen very often, but it is a condition that can land children in the hospital. Some of them need critical care. A few children have died from this condition. But it is pretty rare. But it is one of those things that we track related to children and COVID-19.
All right, Dr. Kaka, the next question comes to us from Ray, and Ray is saying the numbers reported are cumulative for the last 5 months. Is there a way to see how many current cases there are?
As far as people who are currently sick?
Yes.
I think that's what the question is. So we have information on recovery rate. Now, the thing to understand is we do not track people throughout the course of their illness, so we don't know exactly when people are recovered. We have an algorithm that's been developed by other states, other countries that kind of estimate based on when people got sick, how many people may have recovered. So that's available on our website. I don't have that number handy right now, unfortunately, but there is information on our website about the percentage of cases that we estimate have recovered. That number has dropped a little bit as we've seen case numbers rise here in recent weeks. So we've had more people getting sick more recently. So our recovery rate has dropped a little bit, but there is information about that available on our website.
All right, thank you. And one more question here, and this might be going back to the website as well, but this comes to us from Kelly. And Kelly is asking how many Beaufort County deaths were in nursing homes, as well as how many are 75 years old plus?
I believe that's going to be on our website. I don't know exactly what information is pulled out of our website. We do identify deaths within nursing homes and the ages, but you may have to refer to the website for that information. And then if there's questions about it, we have a email address set up to receive questions. It's info @dhec.sc.gov. And questions can be submitted there if there's something that's not covered on our website.
All right, Dr. Katka, thank you. It's so good always having you with us and sharing timely and important information. I want to remind our listeners this morning that we continue to, the Chamber continues to pass out masks throughout the community, and we'll be continuing to do that for the next several weeks or as long as really necessary. Dr. Katka, thank you, and we look forward to hopefully having you back on next week with us again for another update.
Thank you.
And then our final speaker this morning is Greg Kelly, and as most of us know, Greg runs the Savannah Hilton Head International Airport, and we're looking forward to an update on travelers and an airport update from Greg this morning. Greg, welcome. Thanks for joining us.
Thanks, Bill. I'll give a quick overview of what we're seeing here and on the national aviation ecosystem front. With regard to passengers, the national average is right now is about 25% of where it was this time last year. Our average is about 35%, so we're about 10% above national average. Some days we're up to 50%, which is pretty good. In terms of seats, we're at about 50% of where we were this time last year for the month of July, and we're projected to be at about 70% in August, which is good, but there may be a drop off there. Some of the airlines are starting to pull some things back, so that could drop later in the month of August to around 60% in terms of seats. Allegiant and American are representing the substantial portion of the seats and the passengers right now. Some of the key service that has yet to return are Denver with United and Frontier, Detroit with Delta, LaGuardia with Delta, and Toronto with Air Canada. Other than that, most routes have returned to the market. Allegiant is a bright spot. Like I said, they're serving 16 cities in August. The new cities they're serving in August are Punta Gorda, Houston, Bellevue, which is St. Louis, and Stewart Airport, which is about 70 miles north of New York City. And they're offering some really good deals right now, and their loads are pretty substantial as well, which is healthy. Having said that, the New York quarantine is hurting us. We would have expected to have more passengers and more seats, but the New York quarantine is hurting us and the entire aviation system nationally. We're expecting to be back at 70% passengers by the end of the year, an earlier forecast, but we have to reassess that with the quarantines in place and the airlines kind of plateauing a little bit, so that may drop down to between 50 and 60% by the end of the year. On the national front, I think everybody's aware that the airlines are operating under the CARES Act restrictions, which are requiring them to maintain certain route structures in place and to maintain jobs. The CARES Act restrictions expire at the end of September, and that's why the airlines are talking about cutting thousands of jobs. So it'll be interesting to see what happens after that. Having said that, the Congress is considering new legislation right now, which could come with additional restrictions. So we'll see what happens there. I think everybody knows that airports rely on passengers for revenues, and airports across the country are struggling financially across the board. On a positive note, fixed-based operations at airports, general aviation in general, business aviation, and air cargo are doing well. We presently have no health issues here. Passengers seem comfortable and are adjusting to the different requirements and safety practices at the airport and with the airlines. Lastly, it's very important that we get as many people into the airplanes as possible, even with the restrictions in place. We have to position ourselves so that we have a strong market presence for the airlines. So when they look at cutting service at the end of September, our numbers are strong. And as such, we will be working in partnership with the Hilton Head Chamber of Commerce for a second round of marketing efforts and funds. And there'll be more information on that in the near future. On a side note, Bill, I'm not sure if you're aware of this, and your attendees may be interested to know that the Georgia Police Chiefs Association held their annual conference in Savannah last week, and they had over 450 attendees with sessions and exhibit hall, and it worked out very well. So I think that could be a model for return of some sense of group business moving forward. That's all I have right now, Bill.
Thank you, Greg. And that's encouraging about starting to see meetings coming back into play, and so important for many businesses. A couple questions for you this morning, Greg. The first one comes from Janie, and Janie is asking, how are airlines boarding flights now to practice proper social distancing?
Well, right now, the airlines are making announcements at the gates, of course, to keep your distances and to make sure you have masks on. The passengers are actually, doing a pretty good job of policing themselves. Family units are grouping together. Individuals are separating as they move from the gate area into the boarding bridge and on the aircraft. There's still a couple airlines that are not filling all the seats. So once you get on, it depends on the airline about what happens once you get on in terms of seats and spacing on the aircraft. But passengers are doing a pretty good job at distancing themselves and complying with the airline's requirements.
Next question comes to us from David, and David's asking how at baggage claim is social distancing being practiced?
It's similar to the gate area, Bill and Jamie. The passengers, it's interesting. Even we have signage on the floors, or signage in the baggage claim area, but passengers are doing a pretty good job at distancing themselves and policing themselves. So really, it's handling itself, even though we have the signage and everything there. But people are doing a pretty good job at taking care of themselves with the safe practices are accepted.
Greg, thank you. And we all know that how important it is to balance the health of our residents with the health of our economy. And we appreciate what you're doing there at the airport. And we thank you for being on with us again this morning.
Thank you, Bill.
All right. So thank you all for being with us today. And as we go throughout the rest of our week, let's remember to be kind to one another and wear our mask and be safe. Thanks for joining us. Have a great rest of your week. Bye-bye.